Oh, final count was 125 people, everybody.
There we go. Good.
Yeah. Hi, everybody. Welcome. Hit record so I don't forget. Oh. Hi, everybody. Thanks for joining us today for your lunch. I hope you have been able to grab something to eat and drink and get ready for an awesome presentation today. We're so excited to get started in about 5 minutes. So you still have time to go grab some lunch or water. You turn on the chat. I would love to know where you're at in Iowa, like, and what, organization you're with representing today. Go ahead and use the chat function. I think all of us here, Kim and Stephanie and myself, are all in Des Moines. We'd love to know where you guys are from. Oskaloosa, hey, Erica. Newton, awesome. Are you at the hospital there, Taylor, in Newton? Oskaloosa, Warren County, Every Step. Hey, Every Step. Ooh, we got a lot of Newton. Awesome. I live on a farm near Lowmore, Iowa. I don't know that one. Newton. We got a full house today, so awesome. Mercy One. Hey, Courtney. Welcome, welcome, everyone. About 4 minutes. Genesis, Early Head Start, home-based program. Great. I haven't been outside today, so I don't know how nice it is out. Ooh, 73 here in Des Moines. We're excited you guys could all join us today. If you're just joining us, we'll go ahead and get started in about 3 minutes. So you still have time to run to the bathroom, grab something to drink or eat. Tell us where you're from in Iowa. Great. Let people just log in here. Grundy Center. I'm from Conrad, so I know the Grundy Center area. I remember when the movie theater was a penny. Still have friends that live in Grundy Center. Sioux Center, great. Great representation across the state. This is awesome. Corden. Oh, hey, Jill. I know you. I know Corden. Ames. Hey, everybody, if you're just joining us, we're just asking where you're from and across the state. We have a great range. We'll start in about a minute. Movies are $3 now in Grundy Center. Inflation. Still pretty good, like you said. Algona, Iowa City. Hey, Bailey. Hey, Aaron. All right, we have a lot to cover and I have noon. So we're going to go ahead and get started because we're excited to talk to you all today. Thank you so much for being here. A couple of housekeeping things before we get started. This is being recorded. And so after the webinar, either later today or tomorrow, you will get an email with the recording so you can share it with your team members. You'll get a PDF of the slide deck, so you'll have access to that. And then you'll also get a bunch of other links that we'll talk about throughout the presentation today. So we're so excited you're here. We will take our cameras off after a couple slides once we kind of get in, and then we'll turn them back on after the end of the webinar to answer any questions. If you have questions as we go throughout the presentation today, feel free to put them in the Q&A or the chat, whatever you prefer. Your questions might get answered as we go through. But if not, we'll be sure to answer all the questions at the end of the conversation today. But this way, at least you'll put them in the Q&A so you'll remember them. And if they get answered later, great. If not, we'll be sure to answer them live that way. So with that, let's go ahead and get started. Just a quick photos and copyright. All images in this presentation, including those of the babies and videos, are all used with permission. Count the Kicks and Healthy Birthday Inc. are trademark. And just a trigger warning, due to the nature of this presentation, there may be videos, images, and verbiage that may be triggering for some participants. We do have a credit available. So afterwards, filling out the evaluation, I'll send all your contact information to Des Moines University, who will be issuing the certificates that you will be receiving. So thank you for doing that. And then here is your group of wonderful presenters. I am joined by two wonderful, amazing women who I have known for several years now. I'm obviously Megan Ockett. I am the program director with Healthy Birthday Inc., which, as you probably all know, is the nonprofit organization that created Count the Kicks, which is what we're talking about today, a stillbirth prevention education campaign. My background is in public health. I've been in public health for close to 15 years. Before working at Count the Kicks, I worked for Iowa Department of Public Health in tobacco prevention, education, and control. My passion, yeah, Kim, IDPH all the way. My passion is truly empowerment, education, and prevention. I have 3 children. I used the app when it came out, in 2015, 16, 17, and then 18 with my son. I'm just so happy to be working for such an amazing, wonderful organization that is all about empowerment and advocating for yourself. So you'll hear, hopefully, the passion come through all of our voices today, because we're all passionate about saving babies. And it's because of you all on this call today who are going to take this information with you and learn it and implement it, and then help us save babies in our great state. So with that, I'll go ahead and throw it over to Stephanie to introduce herself.
Muted, Steph.
Oh,
Steph,
Stephanie, you're
you're
muted.
Love it when I do that. I was so passionate about what I was
You
saying.
were, I could tell in your face.
Well, hello, everyone. I am so glad to be here on today. My name is Stephanie Moody. I'm the Equity Ambassador with Healthy Birthday, Count the Kicks, and I've worked with Healthy Birthday and stillbirth prevention for about 3 years. My passion for this work in stillbirth prevention came after finding out about the inequities that persist in stillbirth outcomes in the African American community. My passion for the fight against preventable stillbirth inequity comes from the impact that stillbirth had on our family after my sister Angie lost her daughter Jasmine to stillbirth in the early 90s. So while we were working on a campaign to educate the faith-based and community leaders in Des Moines, my son and daughter-in-law actually became pregnant. I asked Courtney if she had heard about the Count the Kicks app, and she was actually using it. Her doctor had told her about it. And then on her due date, Courtney thought that she was in labor, but she noticed that Luna wasn't moving much. When I talked to Courtney, I told her, call her doctor right away, because immediately it translated me back to the early 90s where we lost Jasmine, which was my sister's 5th child she and her husband were expecting to have and to bring home. Unfortunately, Jasmine's cord was too short and she was born still, so we did not get to bring her home. So when she called her doctor, when Courtney called her doctor, they originally told her to drink water, lay on her left side, time her contractions. She was a first-time mom, and there's times where we can feel a little anxious about giving birth, but Court decided to go into the emergency room anyway. She provided her doctors with the information she had from tracking Luna's movements, and she was able to prove that Luna was not moving like normal. And they examined her and found out that there were actually 2 health issues that would have prevented our Luna from having a healthy birthday. So since then, I've continued working with Healthy Birthday, Count the Kicks, to educate and to empower expectant parents and maternal health workers like yourself on the importance of counting, as well as tracking fetal movements in the 3rd trimester. So saving babies, yes, this is a dream job for me, and I am honored to be able to be here and to speak with you all on today about stillbirth prevention. With that, I'll pass it to Kim.
Good afternoon, everybody. How lucky am I to get to do this presentation with these 2 ladies? I am Kimberly Noble Piper, and I'm the Executive Officer for the Center for Congenital and Inherited Disorders at the Iowa Department of Public Health. And that's a long-term that just covers the genetics programs, public health genetics programs that the state provides. Examples would be the newborn screening program, the maternal prenatal screening program, and programs like that. My first career was as a labor and delivery nurse. So I was literally born and raised in labor and delivery. That was my first job. I worked at Iowa Methodist Medical Center in Des Moines, and I know a couple of you from that stint working at Methodist. So hey, shout out to you guys. After 16 years of working in labor and delivery and managing the OB services at Methodist, I transitioned to the Iowa Department of Public Health and was the maternal health or the perinatal health consultant there for a few years, and oversaw the maternal health programs across the state. And then the opportunity to work with the genetics programs came up, and I latched onto that. And I've been doing that, the genetics programs, for about 17 years now, I guess. I know I don't look old enough to have worked anywhere that long, but there we are. There we have it. Those are my careers. My passion for stillbirth prevention stems especially from working in the hospital setting and going through this experience with families. And it is an honor to be able to care for these families, not only in healthy situations, where they deliver happy, healthy babies, but also in the situations where their children are born still. You have a great opportunity to make an impact on these families' lives in a positive way. And it was always an honor to be able to do that. So I'm happy and grateful for the opportunity to talk to you today. I'm going to send it back to Megan.
Thanks, Kim. Thanks, Stephanie. That was great. Let me get my thing. So today we have a lot of great information planned for you today. And one of the things that we'll be doing are some polls. And one of the first polling that we have is coming up next. So I'm going to leave this slide here on a second. So this is a pretty interactive webinar than you might be used to. And that's what we want, right? So we're going to do a couple polls. Just do the first one that comes up first. So what comes to mind when you hear Count the Kicks? So you can respond, you can go to that website, or you can just text Count the Kick, no S, 415 to 22333. So I'll give you just a couple minutes to kind of get situated and get into the system where you can start answering this question. So what comes to mind when you hear Count the Kicks? And what's really cool about this is what you're going to see is it's going to be this cloud it's going to form. So the more times people say the same thing, that word would get bigger. And then, so we have bracelets. Those are our kick counting bracelets. That's awesome that somebody said that. Movements, monitoring, saving babies, that's getting bigger. So that's awesome. I'll give you just a couple more minutes to see what we have. Oh, somebody's driving, so they don't answer, but I think counting the kicks and movements monitoring. That's awesome. Thank you for saying that. monitoring movement. So yeah, so just be thinking about that as we're moving through. I think in Iowa, it's really well known what Count the Kicks is. Normally, one of my first questions is, have you heard about Count the Kicks? And so I think everybody would probably most likely say yes to that question. So we thought more, it would be interesting to know what comes to mind when you hear Count the Kicks here in Iowa. So check, fetal, patient, track. This is awesome. So thank you so much for doing that. This is wonderful. And so before we get started and really dive into the research and the data, so some things you might not have heard before, I really like to share this video. And I share this video for a couple reasons. And maybe you've already seen it, or maybe this is your first time, but I share this video because this is what you're going to remember. When you leave today and you're done with this presentation, you're going to remember baby Ruby, you're going to remember baby Nala, you're going to remember baby Luna, Stephanie's story of her granddaughter, because that's why we do what we do, right? We're trying to save babies from preventable stillbirths. So this is a story that ran on Good Morning America in 2017. Baby Ruby was saved when her mom noticed reduced fetal movement. I share it for a couple of reasons. One, it's a feel-good story. Two, we might reference some of the verbiage and terminology and things that especially baby Ruby's mom says throughout the presentation. And I also share it, if you're not that familiar with Count the Kicks, it does do a really good job of walking you through how the app works and how it can truly make an impact and save a life. And then I also like to show it because when this aired in 2017, we saw about a 3,700% increase, a spike in our app downloads. The power of storytelling is unmatched. So anytime you can share a story like this, you can share a YouTube video that we have on our page with the expectant parents you serve, or you can put them in a waiting room. I highly recommend you do so because this is what you're going to remember. This is what your patients are going to remember. This is what sticks with you. So let's go ahead and watch baby Ruby's story.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
I love it. And I love that little baby stretch at the end. Go ahead, Kim.
Thanks. Yeah, how cool is that? Well, we need to start off by making sure we're on a level playing field and working off the same definitions and understanding for stillbirth. These are the definitions of stillbirth and miscarriage and infant mortality in the United States. Other countries vary sometimes in their definitions, But a miscarriage is typically defined as a loss of a baby before the 20th week of pregnancy. And then a stillbirth or a fetal death. You'll hear me refer to fetal death. And I think that kind of harkens back to my clinical experience where we called it a fetal death, but they're synonymous in this instance. But a stillbirth is the loss of a baby after 20 weeks of pregnancy. And it's further classified as either early, late, or term. So an early stillbirth is a fetal death occurring between 20 and 27 completed weeks of pregnancy. A late stillbirth occurs between 28 and 36 completed pregnancy weeks, and a term stillbirth occurs between 37 or more completed pregnancy weeks. And on average, 23,500 babies are born still every year in the United States. So you need to note that more babies are lost to stillbirth every year than to infant death, but we just don't hear about that as much. Infant mortality is described as the death of an infant before his or her first birthday. And on average, around 22,000 infants die every year in the United States. And here's a link on here to that information. So causes of stillbirth. As a former labor and delivery nurse, we were often asked, and we asked ourselves, why was this baby stillborn? And in 2011, the NIH, National Institutes of Health, published a study that included a description of possible causes of stillbirth. The study is called the Stillbirth Collaborative Research Network Writing Group, and was published in the Journal of the American Medical Association in 2011. And the link to that study is included here. But to highlight some of the points made in the publication, it discusses the likely causes from pregnancy and labor complications, problems with the placenta, birth defects, infection, problems with the umbilical cord, high blood pressure disorders, and medical complications in the mother. And those are listed in order of frequency. And then just many times the causes or contributing factors to the stillbirth, we just don't know. And here's stillbirth by the numbers. At the national level, there are 23,500 stillbirths every year, as I mentioned before, and that's 1 in every 169 pregnancies that end in stillbirth. Racial disparities do persist. Black mothers experience a stillbirth 1 of every 96 Black mothers. Hispanic moms are 1 in every 199. Indigenous moms are 1 in every 138 births. White moms are 1 to every 204 births. And Asian and Pacific Islanders are 1 in every 233 births. And again, this is more prevalent than infant mortality. And families are 10 times more likely to lose a baby to stillbirth than to SIDS. I'm willing to bet that also many of you have either experienced a pregnancy loss yourself or someone close to you has.
Yeah. And I would just add to Kim, that's 65 babies a day, right? So that's like a busload of children. So if we think about it in terms of that, it's extremely high. And so that's what we're here to talk about today, about how we can prevent that and prevent preventable stillbirths.
Mm-hmm. That's per day.
Per day, 65 babies per day. Yeah.
Yeah, that's just mind blowing.
Mm-hmm.
Here's a quote from Abraham Lincoln. I like this quote and I use it a lot, but Abe had said, if we could first know where we are and whither we are tending, we could better judge what to do and how to do it. So essentially he's saying, we got to figure out what's going on before we can act on that information and make decisions about what we need to do. So we need information about the timing of the stillbirth, maternal health and reproductive history, the environment, which includes their geographic location, any circumstances surrounding the birth, such as decreased fetal movement, trauma, exposure to teratogens, et cetera, and then any information about fetal, placental, and umbilical cord exams. So, going back to Abe, who knew that Abe was an epidemiologist, in addition to wearing many other tall stovepipe hats that he did. So we do need that information, expanded information, and that a lot of that information is not available from the fetal death certificate. The fetal death certificate is the official record that is filed with the state, but that information is very high level. And fetal death certificates are not always accurate. A lot of times they're missing important data, such as the causes or contributing factors of the death, and may even be submitted for deaths that don't meet the definition of fetal death. I've seen a lot of fetal death certificates that state the cause of death as IUFD, And probably a lot of you know that that just is, that indicates intrauterine fetal demise, which isn't a cause of death, it's the location of the death. So a lot of times the fetal death certificates just aren't as helpful or give us enough information that we need. So the Iowa Department of Public Health has developed a fetal death evaluation protocol to be used by birthing facilities and birth providers. And this protocol provides guidance for working with families through the experience, including some cultural considerations. It offers guidelines for the clinical evaluation of the stillbirth and includes the fetal death evaluation form, which is submitted to the Iowa Department of Public Health and which provides more detail about the occurrence of a stillbirth. The fetal death evaluation form of the protocol not only allows us comparisons with the fetal death certificate, where we can see if there are any discrepancies or missing information, but also provides much more information about the circumstances surrounding the death, as well as it allows the mother and the family an opportunity to recount their experiences leading up to the stillbirth. And submission of this fetal death evaluation form is voluntary by hospitals and providers, but I really encourage you to use the form and submit it to the department. The information that it provides is invaluable. And the fetal death certificate cannot be changed as it is an official record, but information from the fetal death evaluation form can better inform stillbirth prevention efforts. And for this presentation, the data that you'll see come from the official records, the fetal death certificates filed with the Iowa Bureau of Health Statistics. So we look at the evidence. So the Count the Kicks initiative launched in 2008, and that's indicated by the yellow arrow on here. And this initiative came out of the heartache of 5 moms who experienced the death of their daughters. The fetal death rate has declined over 20% since the high in 2009, and it's on track to better that rate in 2021, 28% according to the preliminary data. We don't have the official 2021 data yet. It should be coming out pretty soon though. And while we cannot say that this decline has been solely due to Count the Kicks campaign, this campaign is the only intervention that we know of that may have impacted the fetal death rate at that time. One important note is that the majority of the US has remained pretty stagnant, whereas Iowa rates has decreased. Of course, there are some years it fluctuates, but it's important to look at the data yearly and on averages. A large syphilis outbreak or many other outside factors could cause a spike. And there are just a variety of factors that could lead to an increase or decrease in a state stillbirth rate. But one important takeaway for Iowa is that when risk factors like the smoking rate and obesity rates have increased during this time frame, our stillbirth rate still saw a steady decline while the rest of the country has remained stagnant. The fetal death rate for 2020 and 2021 remained low despite the potential impact of COVID-19. And those data are still coming in and being evaluated. So let's take a little deeper dive into equity. Stephanie?
All right. Well, thank you so much, Kim. So through this section of our webinar, we're going to examine why these disparities exist that she has alluded to and talked about. We want to understand the difference between implicit and explicit bias. And we're going to hear about some research that's going to assist us in understanding the effects of implicit bias, as well as the effects of unjust healthcare systems. And then together, we're going to think about solutions that will address these inequities for those who are most impacted by stillbirth outcomes. There's a quote from George Washington University, their online Master of Public Health program, and it says, while the terms equity and equality may sound similar, the implementation of one versus the other can lead to dramatically different outcomes for people who are part of groups that are considered marginalized. They explain that equality means each individual or group of people is given the same exact resource or opportunities. Equity recognizes that each person has a different circumstance and allocates the exact resource and opportunities that are needed to reach an equal outcome. To help us better understand the difference in the terms and the illustration that we see on the screen today, we have 3 individuals who have unequal access to participate in watching a soccer game. So let's say that the game represents our healthcare system. By providing equal support from evenly distributed tools, their access to see the game still continues to remain unequal. The equitable solution, however, allocates the exact resources that each person needs to see the game, leading to positive outcomes for all individuals. Justice is when we remove the barriers altogether. Through this training, our hope is to move our healthcare systems and our maternal health workers from the idea of equality to understanding the need for equity and eventually justice that completely removes those barriers. I love this quote from Paula Dressel of the Race Matters Institute, and she says, "The route to achieving equity will not be accomplished through treating everyone equally. It will be achieved by treating everyone justly according to their circumstances." To help us get that understanding of the concept that she's speaking of, we can look at the accommodations that we provide the laws in places for people who have disabilities. There's specific accommodations that are provided to assist with the barriers that would naturally keep them from accessing public places like restrooms and public transportation systems. However, the justice comes in when the Americans with Disabilities Act was instituted. The Americans with Disabilities Act, or ADA, prohibits discrimination against people with disabilities in several areas, including employment, transportation, public accommodations, communications, and access to state and local government programs and services. Next slide, please. So many studies have been conducted that proves that there's a mistrust between medical professionals and the BIPOC community. And the question is why? So in order for us to understand this, we want to look at the history of gynecology and Black women. Dr. J. Marion Sims is known as the founding father of gynecology because he created an early version of the vaginal speculum. He's credited with the current procedure to repair vasicovaginal fistulas, which is a postpartum condition where urine begins to leak through the vagina. So his breakthroughs were built on the backs of enslaved Black women and the persisting medical myth that he perpetuated that Black women feel less pain. He acquired enslaved Black women. At least two were named Betsy and Lucy, who were like prisoners. They could not meaningfully consent because they couldn't refuse the treatment that he was giving them. They were repeatedly subjected to experiments without anesthesia. Most of the women that he experimented on later died of infection. So to gather his knowledge, he operated on upwards of 20 times on a single Black woman patient who'd be on all fours. And he would in turn perfect the techniques he was doing on medicated white bodies. It was reported that some of Sims' supporters say that the women were in extreme pain but they wanted the procedure so that they could get help. Sims was described as a prime example of progress in the medical profession made at the expense of a vulnerable population. Next slide, please. We want to recognize the mothers of gynecology to honor the sacrifices that were made by Anarcha, Lucy, and Betsy, who were enslaved experimental subjects of Dr. Sims. Black women experience a thing that's called physical weathering, meaning our bodies age faster than white women's bodies due to exposure to chronic stress linked to socioeconomic disadvantages and discrimination over the life's course, thus making our pregnancies riskier at an early age. Every time we are disparaged against or made to feel as if we have little or no worth, it ages our body. We begin to experience that weathering. And this begins when we're children, when we're made to feel less than because of the texture of our hair, because of the size of our noses, the way our bodies are shaped. It plays into that weathering, causes that stress, and causes us to age a little faster. It also shapes the way that we look at ourselves and the way that we view our own bodies, again, making pregnancies more stressful. Next slide, please. The history and treatment of Black men and women has created a mistrust between providers and patients. In an article released in the New York Times, there were 222 white medical students and residents who were polled, and half of them endorsed that same myth. At least one myth about physiological differences between Black people and white people. A quote from the article states, a 2016 survey of 222 white medical students and residents published in the Proceedings of the National Academy of Sciences showed that half of them endorsed at least one myth about physiological differences between Black people and white people, including that Black people's nerve endings are less sensitive than white people's. When asked to imagine how much pain white or Black patients experience in hypothetical situations, the medical students and residents insisted that Black people felt less pain. This made the providers less likely to recommend appropriate treatment. A third of these doctors-to-be also still believe the lie that Thomas Hamilton tortured John Brown to prove nearly 2 centuries ago that Black people's skin is thicker than a white person's skin. This disconnect allows scientists, doctors, and other medical providers, and those training to fill their positions in the future to ignore their own complicity in healthcare inequality and gloss over the internalized racism and both conscious and unconscious bias that drive them to go against their very oath to do no harm. The centuries-old belief in racial differences and physiology has continued to mask the brutal effects of discrimination and structural inequities. Instead, placing blame on individuals and their communities for statistically poor health outcomes. Rather than conceptualizing race as a risk factor that predicts disease or disability because of a fixed susceptibility conceived on shaky ground centuries ago, we would do better to understand race as a proxy for bias, disadvantage, and ill treatment. The poor health outcomes of Black people, the targets of discrimination over hundreds of years and numerous generations, may be a harbinger for the future health of an increasingly diverse and unequal America. If you get a chance to read this article, and we're going to send you the link so that you can look at it, it is very apparent that there is still much work to be done. And it's through trainings like these that we can be trained to identify when misinformation is impacting the care that we provide to others. In order to address the myths and change stillbirth outcomes implicit bias and distortion of truths create, we must replace misinformation with the factual alternative. As we examine ourselves, we may find that this is not an area that affects our decision-making capability. However, we must be prepared to address these issues when they are presented to us by our peers that we work with every day. During this presentation, I want you to begin thinking about this question. How would I address a peer that believed this type of a myth regarding physical racial differences? Prepare an answer for it and be prepared to stand if you ever encounter it. Next slide, please. As we have learned, there's a large divide when it comes to those who are more likely to experience a stillbirth. I want to take a moment to share what research has shown to be some contributing factors to this. Please note that Healthy Birthday Inc. has reviewed research articles, and these points come from various articles that we'll be happy to share with you if you're interested. You can also go to www.countthe-kicks.org, and you'll be able to see a lot of research there as well if you're really interested in it. So researchers point to the following as causes for the disparities that persist. One is systemic racism. And that is when policies and practices that exist throughout a whole society or organization that result in and support a continued unfair advantage to some people and unfair or harmful treatment to others based on race. Another issue is toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and all that comes with it, have led to real and pervasive health issues for Black women. Another is epigenetics, and that is the study of how your behaviors and environments can cause changes that affect the way that your genes work. So unlike genetic changes, epigenetic changes are reversible and they do not change your DNA sequence, but they can change how your body reads a DNA sequence. Then there's predispositions to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, or high blood pressure. These are all linked to maternal stress. And experts say that Black expectant parents are less likely than other races to receive early treatment for these conditions. Issues with access to healthcare, socioeconomic barriers. Research also shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby to stillbirth than a high school educated white woman. Next slide, please.
Stephanie,
No.
this is Ken.
Yes.
Just a comment about epigenetics.
Yes.
While epigenetics or the impact of the environment and experiences of a person don't affect their DNA explicitly, the epigenome, the changes in the epigenome of the person can still be inherited from their ancestors. So those can be passed down for generations, the effects of the environment. So even though it's not DNA based per se, it definitely affects the way your DNA is expressed, and that can be handed down through generations.
I thank you so much for sharing that with us on today. That is so important to recognize and understand that it generationally can impact us. So it's very important that we make the changes now so that we can impact the generations to come. Thank you so much, Kim. Now, you might be asking, what is Count the Kicks doing to reduce these disparities in stillbirth outcomes? One of the things that we've done is our app is in 14 languages. We make sure that our educational material is culturally appropriate to be sure that potential app users can identify with the face that they see on our brochures, our posters, and in our videos. We have videos, printed educational materials, and also have our frequently asked questions in multiple languages. We're also currently looking for a health equity coordinator whose responsibility will be to look at the inequities in birth outcomes in the states that we partner with, and they're going to help to develop those strategies to address it. Part of the strategy is building those partnerships with community organizations that serve within communities that are considered marginalized, so that we're not only educating expectant parents, but also educating the providers, doulas, midwives, home health and maternal health workers as well. Our goal at Healthy Birthday is to work together with those who are the boots on the ground and get the information into the hands of those who are most impacted by stillbirth outcomes. I want us to move to a place where race is no longer a predictor of stillbirth. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. One of the ways that we utilize the funding is we translate our app and our brochures to meet the needs of those who maybe don't speak English, or it's not their first language, or maybe they have reading issues with being able to read and comprehend. We're an inclusive organization with 100% of our board and our staff members all trained on anti-oppression and structural racism. We work within marginalized communities by improving our programming based on the lived experiences that are shared with us by women of color and focus groups. So as we learn more about the issues that they have faced and the things that they have endured, we work to identify those solutions, and then we get that information into the hands of our partners so that we can work on implementation of those solutions. Next slide, please. So a better picture of fetal deaths by race in Iowa is seen when you look at the number of fetal deaths by race as a part of the total births for that race only. So these rates are the stillbirth rates, and they're broken down specifically by race versus having all of the stillbirth rates lumped together. If you look at the orange line, you'll see that is the African American rate, and you can see that it is higher than any of the others. You'll also notice that there was a high of 17.4% in 2005 and a low of 3.7% in 2011. Count the Kicks began in 2008, which is where you see the green arrow. Within the first 5 years of the campaign beginning, we noticed a 39% reduction in the stillbirth rates among African American expectant parents. To highlight the fact that representation is so important, in 2018, we launched our Feel the Beat campaign, where we used a video of a Black expectant parent who shared about the importance of counting and tracking fetal movement in the 3rd trimester, as well as highlighting the fact that we are 2 times more likely to lose our baby to stillbirth when compared to our white peer, friend, neighbor, or family member. As you can see, there was a decrease of almost 30% from 2018 to 2019 with that campaign and the outreach to Black communities, which you'll see that 2019 purple arrow. Thank you so much. Can you go to the next slide for me, please? So our goal is to educate and empower expectant parents, but also providers who assist in their care. After learning about stillbirth prevention, you might be wondering, what can I do to reduce disparities in stillbirth outcomes? There are things that you can do to help us to join in the fight. Number one, you can leave your biases at the door. If you recognize that you have one, definitely let it go and provide the care that you have promised to give. Also, internal and external recognition of biases. Be the voice. During the training, you may have realized that maybe you've been biased towards a race, a culture, or a person's sexual orientation. Recognition is the first step to addressing the issue. The next step is making the decision to do something to correct the behavior. Whether it is within you or something that you've identified within the organization that you work in, be the voice, speak up and address the misinformation, address racism or any biases that you see that could impact the care a patient is receiving. You can also identify potential best practices such as listen to expectant parents, especially first-time parents. Don't automatically assume, like they tried to do with my daughter-in-law, that, oh, they're just a first-time parent, they're nervous. Listen, be empathetic, sit with them, give them some eye contact, be with them, ask them if they feel comfortable. Advocate for specific protocols surrounding reduced fetal movement as well. Because if you have those protocols in place, people are more apt to utilize them. And offer the Count the Kicks app in the 3rd trimester. Ensure that your media and brochures within your office include a representation for people of color. And lastly, educate, educate, educate. Now that you know, begin to share what it is that you have learned. Next slide, please. In order to continue making a difference in these staggering statistics, we must infuse equity in all that we do, and communication is the key to making that difference. According to ACOG, implicit and explicit bias and racism are implicated in many health disparities, including perinatal morbidity and mortality. But we can change these outcomes simply by sharing what we know with every patient or client that we serve. Our hope is that today you are being empowered with the tools to not just talk about stillbirth prevention, but also provide health literacy to your patients and your clients. And we'll get more into that here a little later in the presentation. By doing these 5 things, when you talk to your patients and clients, you automatically increase their health literacy. One of the easiest ways to infuse equity is simply by listening to your patient and learn about them. Ask strategic and open-ended questions about kick counting to help you assess what the individual patient understands, feels, and desires. Did you know that closed-ended questions could prevent conversations and actually create confusion? So you'll want to use open-ended questions like, is your baby moving? Open-ended questions allow you to learn what the parent knows and understands. So examples, I'm sorry, that first example was a closed-ended question, but open-ended questions will be like, tell me about your baby's movements. How is tracking your baby's movements going? Can you show me your kick counting graph? What questions do you have about your baby's movements? You want to repeat back what you heard them say. This is going to let your client know that you're actually listening, and it's going to establish trust with them because they're going to feel heard. Serena Williams makes over $18 million a year. She's an athlete, she's college educated, yet she's a Black female who was not being heard by those who were supposed to be providing her with care. It's believed that due to her race and gender, that she was almost another statistic. Serena experienced blood clots after giving birth to her first child. She was in excruciating pain after she had had a C-section, and she knew that she was prone to blood clots. However, she was able to save her own life by speaking up about what she was experiencing and what she knew was happening with her body. Her example is seen as a perfect example of racist medical matricide. When she commented on the issue after the fact, Serena said that we must start empowering adolescent girls to demand quality care. So again, educate, listen, educate, listen. We also want to be equitable, avoid assumptions, and provide all expectant parents, no matter their race, their gender, religion, socioeconomic status, sexual orientation, marital status, or even educational level. You want to give them the same information and the same interaction. Did you know only 12% of US adults have the health literacy proficiency to perform complex health tasks? Higher education does not necessitate high health literacy. Even patients with high levels of literacy have difficulty understanding health information and services. Be clear and concise. Avoid long and complex explanations. Get away from medical terminology. Consider everyday vocabulary. Did you know Count the Kicks educational materials are parent-focused and empower our expectant parents? They're free, they're low-cost educational resources for the provider and for the patients, and they are ready to go in your area, right here in Iowa, and they're free for us. We also want to be honest, speak the truth while still practicing empathy and compassion. Did you know that pregnancy is full of risks that we educate expectant parents about? Stillbirth should not be an exception. Educating on Count the Kicks and encouraging a parent to speak up will help ensure a parent with a concern will contact their provider and be able to save their baby's life. We also want to ask for understanding. Before ending the interaction with them, ask the patient to explain what they understood back to you and ask if they have any further questions. Did you know that rewording information shared can help clarify and improve their understanding? Provide them with visuals like the Count the Kicks brochure or the app. Many stillbirth moms report a complete lack of awareness that stillbirth was even a possibility and that a change in movement was an important issue to report to their doctor. Lastly, we want to reteach. If a patient displays confusion or a lack of understanding, make sure to correct and clarify. Provide extra support to those who need it. Develop an internal system to ensure that individuals' needs are met. Connect with them so that they have the additional resources that are needed. Let's learn more about the research and evidence behind this campaign. I'm going to turn it over to Megan now.
Thanks, Stephanie. That was a lot of great information that I think everybody can take back and utilize and learn from. So I'll give you a break and allow you to get a drink of water from all of that great information. So like Stephanie said, let's go into the research and evidence behind this campaign. If you're really into reading research and journal articles, awesome. We have a whole webpage dedicated to that on our evidence section on our website. But if you're really not into reading journal articles, I suggest you at least read one. And the one I'd like you to read is the one that you see on your screen right here, The Reduction of Late Stillbirth with the Introduction of Fetal Movement Information and Guidelines, a Clinical Quality Improvement. And I want you to read this one because this is the one that started it all. And what I mean by that is, like Kim said earlier, Count the Kicks was created out of the loss from 5 central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss. They got connected through pastors or friends. And as they started connecting and grieving together and talking about their experiences, and they started to realize they had very similar situations. They all relatively had stillbirths around the same time frame. Their doctors or providers had said it's not that common. Some even said it was like getting struck by lightning, which in fact it's a lot more common than getting struck by lightning. And so that got them thinking that stillbirth is a lot more common than people think. Like Kim and Stephanie have told you earlier, 1 in 169 pregnancies ends in stillbirth. So long story short, one of the founders worked with Senator Tom Harkin at the time to get the first ever stillbirth registry, funding from the CDC to create the stillbirth registry first stillbirth registry in the nation, to start collecting trends in stillbirth in Iowa. Where are some counties with high stillbirth rates? What's going on in those counties? That type of thing. So it was because of this funding and the stillbirth registry that a couple of the founders went to a public health conference where they presented on it, but they also heard from other researchers. And one of the presentations that stood out was this one that Dr. Ruth Fretz was part of. She is a Harvard Medical School assistant professor, OBGYN, and a researcher. And she was talking about how in Norway, there was a study that was done where when expectant parents were educated on the importance of tracking their baby's movement in the 3rd trimester, that babies could be saved when they started to get to know what was normal for their baby, and to speak up to their provider if they noticed a change. And so the founders hearing this heard that there was about a 30% reduction among this cohort of women when they were educated on getting to know what's important or how their baby's normal movement pattern is. So that's what the founders heard. They said, that's amazing. Great stuff happens. Great stuff's created here in Iowa. Let's create an empowering public health campaign to educate expectant parents, give them the tools and resources to be able to track their baby's movements, but to also give tools and resources to those that work with expectant parents on talking about stillbirth and stillbirth prevention, because they knew firsthand how dark and tragic it is. And that's what they did. They came back. If you know the material, you know it's bright, it's empowering, it's colorful. And so this quote from Dr. Ruth Fretz, where she says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. The founders heard this and they said, we can do this. They came back and talked to your very own Kim Piper on the call today and said, how do we make this happen? And together they worked with a local marketing company and they made it happen. And here we are almost, almost 15 years later with this stillbirth prevention evidence-based campaign. There's also evidence behind this, additional evidence behind this campaign. And in fact, so much evidence and so much replication and our work that's been done over the last 10, 12, 13 years that the Association of Maternal Child Health Programs named Count the Kicks a best practice after a thorough scientific review within the leading maternal health association in the United States, where they look at things like how we infuse equity, making sure that's an integral component, if it's sustainable, it's been validated, and it can be replicated with additional, similar positive results. So we're proud to be named a best practice. And then if you're familiar with the Hear Her campaign by the CDC, they issued out as part of their Hear Her campaign to reduce maternal mortality in the United States. The CDC lists those 15 urgent warning signs, and the importance of paying attention to babies' movements is one of the key markers. So it's all connected. I think one of the top questions we get asked during presentations like this is just going to increase my patient's anxiety. I'm going to get a bunch of calls. My nursing staff's going to be inundated with it. And we're here to tell you that doesn't happen. Kit County does not increase anxiety in most pregnant women. This study stated that one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. And usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. That's because now they have data in their hands. They know what's normal for their baby. They know when to speak up and how to speak up. We worked with Des Moines University and the Harkin Institute to research our own app users, thousands of app users, and found that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. The researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased in awareness of a change in fetal movement and a reduction in stillbirth. There's also added benefits for maternal fetal movement monitoring, things like reduction of preterm birth rate, fetal growth restrictions can be identified earlier. And so this research study that stated that due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. What we also know is that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. That is why we issued a white paper in April that Stephanie is going to talk to you about. Go ahead, Stephanie.
Thank you so much. So before we go further into what Count the Kicks is and how to actually use the app, I wanted to take a moment to share about our newest resource for the general public, but also especially for those that care for expectant parents. We released a white paper with the Harkin Institute titled The Link Between Stillbirth and Maternal Mortality and Morbidity, Firsthand Accounts from American women. Sorry, I'm in African American mode. The purpose of this white paper is to highlight the connection between stillbirth and maternal mortality and morbidity, and how Count the Kicks can help improve health outcomes for expectant parents and babies. Research shows that the risk of severe maternal morbidity is more than 4 times higher among stillbirth deliveries compared with live births. So as we've already discussed, racial discrimination is a significant risk factor for adverse birth outcomes. According to the CDC, white women make up 13.4% of deaths due to pregnancy-related causes, while African American women make up 41.7% of pregnancy-related deaths. The rate is similar to that of women in developing countries. Implicit bias is an immediate and large part of the systemic issue, and we must take immediate action to counteract it. This white paper highlights these disparities and tells the stories of 8 women who almost lost their lives due to pregnancy-related complications. These firsthand accounts illustrate how a change in baby's movement can be a red flag for both moms and their babies, and how counting kicks and being monitored for reduced fetal movement led to an improved birth outcome for both the mother and the baby. The white paper shares real solutions and clearly notes that Count the Kicks is one evidence-based tool to help improve birth outcomes for expectant parents and their babies. To read the full report, you want to visit the link that is on this slide that we're going to send to you in the full slide deck, and you're going to be able to look for more information on the report in the post-event email. So right now, I'd like to share a few facts that we've pulled out of the document for you to learn about. And for the sake of time, I'm going to go through them quickly. But again, remember, we're going to send you a copy of the slide deck so that you'll have this information. So no worries about writing everything down immediately. All right, next slide, please. All right, one stat is, according to one study, more than 15% of maternal deaths within days of delivery occur in women who experience a previous stillbirth. Next slide. African American women are 2 times more likely to die during or after pregnancy than their white peer or counterparts. Next slide, please. Implicit bias is an immediate and large part of the systemic issue, and we must take immediate action to counteract it. This is why trainings like these are so important, and that we implement what we learn today. Implicit bias is called unconscious bias because it happens unintentionally. You don't realize that you're actually doing it. Next slide, please. It is imperative that providers are proactively discussing stillbirth prevention or risk factors with their patients and providing evidence-based solutions like Count the Kicks to every patient that they work with. Next slide, please. All right, we have another poll for you. So the question on this one is, do you talk to expectant parents about the importance of tracking fetal movement in the 3rd trimester at every appointment? Answer A for yes and B for no.
Right, at every appointment, right? That's the key there. Yeah, you could put it in the chat too if you don't have it pulled up on your phone or your other web browser. I'll give it a couple minutes or so. It's just something to think about, because that's what we want to stress today, is that every time you meet with your patient, or maybe you meet your home visitor and you meet with them monthly or something like that, if they're in the 3rd trimester, please talk to them about this. Even if you did it during their last appointment, the more touch points we have with the individual, the better. So we'll keep that up, but feel free to keep answering it, but we'll continue on too for time's sake. And remember, this does go till 1:30, so it's a 90-minute webinar. So let's learn more about Count the Kicks. Go ahead, Stephanie.
All right, thank you. So what is Count the Kicks? Count the Kicks is our evidence-based stillbirth prevention public health campaign that educates expectant parents on the importance of tracking fetal movement in the third trimester. Our app is an early warning system that provides parents with that data that empowers them to speak up to their providers if there's a concern, just like my daughter-in-law Courtney did, and it saved our granddaughter Luna's life. Now, I'm sure that everyone who's on the call today would agree that, again, stillbirth is not a subject that anyone is excited to talk about. This is why you'll notice that when you look at our materials, they are fun, they are bright, just like Megan said. They're colorful, they're empowering. It's mom-focused and baby-focused, helping to develop that bonding time between mom and baby while the baby is still in utero. This bonding time during the kick counting session can be shared with spouses, partners, siblings, and everyone can be a part of getting to know what is normal for baby before baby even arrives. So maybe you've got one sibling counting the kick and the other one touching their little baby footprint every time they feel a movement. We have both a mobile app and we also have paper charts that are on our website for those who may struggle having access to a mobile device or even access to the internet. We know that through use of our app, 1 in 3 at-risk babies can be saved simply by teaching expectant parents to use our free Count the Kicks app in the third trimester. We have proof that our app is highly effective because, as we shared on previous slides, we've seen that same reduction in the stillbirth rates right here in Iowa through implementation of Count the Kicks. Next slide, please. The reason why counting and tracking fetal movement in the third trimester is so important is it's because it's the way that baby communicates with us before they're born. A change in baby's movement can be an early sign and sometimes the only warning that baby may give us when they're in distress. So think of it this way. When we're not feeling well, we're not up doing laundry, running up and down the stairs, going to the store. We have a change in our activity level. So instead of running around, we may lay in bed a little longer instead of exercising or doing the daily activities. We slow down. So it's the same thing for baby in utero. When they don't feel well, their way of communicating to us that something's happening is they give less kicks or their kicks are softer. So their movements might become less or they may become weaker during a time of distress. When a baby's not feeling well, they naturally preserve blood flow to the vital organs such as their brain and heart so that they can conserve energy. And what they're doing is they're protecting themselves from meeting demise. Go ahead to the next slide. Thank you. There are 3 types of movement changes that you can educate your clients on. The first one is baby has fewer or no movements. They slow down. So again, they're preserving that energy and blood flow to their organs. And if they notice it, they need to speak up to their provider right away. The second is baby may move, but the movements are softer or weaker. This is another sign. Baby might be in trouble. And the third is a sudden wild surge of movement that can indicate that the baby is in distress. So what we've seen this happen with is with cords that are in a tight knot. So think if you were unable to breathe, there would be, a wild surge of movement that you would give. Baby would do the same thing. If that happens, speak up, let your provider know. Educate your clients to do that and to let their providers know something's going on. And if the provider's not listening, go on and go into the hospital. So we want to, I'm sorry, I'm sorry. Since kick counting matters, we want to start counting now. So we have our QR code up here right now. We want to begin having that conversation at 28 weeks gestation or 26 weeks if they are considered high risk. This is when research shows that baby has established a consistent pattern that the expectant parent can feel and can track. Now, this is the only time you're going to hear me tell you to multitask while you are in a webinar and learning. We have our QR code on the screen. You can take your camera, hover over the QR code and be able to download our free app so that you can begin to play with it and know how to talk about it. So when they're counting, we want to count everything. as a kick. That would be your kicks, your rolls, your jabs, anything except for hiccups, because hiccups are involuntary movements. And so we do this in the 3rd trimester. And we want to make sure that we're asking them those questions at every appointment. Are they counting each day? Do they know their baby's normal pattern? And make sure that they know to speak up if there is a change. A helpful tip, if they're waiting on a glucose test, this is the perfect time to download that app. Next slide, please. So let's talk about our free Hallmark tool that we have been sharing about, our Count the Kicks app. Our app has been downloaded over 160,000 times in over 140 countries. First, let me note that there are no advertisements. There are no pop-ups on our apps to distract mom or to slow down their kick counting session. We regularly survey our app users and we listen to their feedback, and we implement changes so that we can improve the experiences. Again, our app is free. It's available in over 14 languages, and it's also available for Apple and Android. If they get interrupted during a kick counting session, they can restart their kick counting session or delete a kick if they accidentally track one. Now, we're all pretty busy, and if you're anything like I was when I was pregnant, pregnancy brain is a real thing, and you can set a daily reminder to help them to remember to count those kicks at the same time each day. After a few days of kick counting, they're going to begin to see a pattern for their baby. We want them to sit with their feet up, lay on their left side, and each time they feel a kick, a roll, or a jab, tap the little baby footprint that you see on the screen. They're going to be able to review their kick counting history, download it, share it with their provider. They can discuss it at their appointments. And also they can discuss it with their family members, their partner, or their spouse. The app will also track future pregnancies so that they don't have to create a new account with each pregnancy, and they can manage their account on multiple devices, including their Apple smartwatch. And then another cool thing that we have coming is we are about to launch a web counter. So be on the lookout for more information about the web counter that's coming soon. We also added a strength tracking feature because research shows expectant parents should also be paying attention to the strength of their baby's movements while counting and tracking their kicks. With our new strength tracking feature, at the end of each kick counting session, they'll be asked to rate the strength of their baby's movements. So if baby's movements become weaker, again, it can be a sign that their baby needs to be evaluated. This new feature teaches them how to judge the strength of their baby's movement, and they can rate their session from fluttery to fierce. Fluttery is going to be the light movements that are hard to see from the outside, similar to what's felt when they first start feeling baby move. Fierce is going to be the strong movements where they can visibly see baby moving around on the inside. It can feel like a limb is literally going to poke out of their belly. I don't know if you ever experienced it, but I did. Your stomach looks like an alien is in there. And they simply rate the strength of their kick counting session by selecting fluttery, which is indicated by 1 footprint, up to fierce, which is 5 footprints. They can include a note that details how the session went and what they may have noticed during the session. So this note just says, baby felt strong like normal. Once they finalize the session, they're going to see a graph showing them the strength average as well as the average time that it takes for their baby to get to 10 kicks. If they notice a significant increase in the average time where it's taken baby way longer to get to 10, or they notice a decrease in the strength of baby's movements, they want to contact their provider right away. I cannot stress that enough. Reduction in fetal movement can signal anything from low amniotic fluid or a ruptured amniotic sac to a tangled or knotted umbilical cord. If their provider's office is closed, hospitals are open 24 hours a day, 7 days a week, ready to serve them. The risk of not speaking up outweighs the risk of not going in. Next slide, please. We also have new video capabilities that inform and educate our app users on how to count their baby's movements, what to track, when to track, how counting kicks or why counting kicks is so important, as well as short tutorials of any new features that we have on our app. Next slide. We are excited to announce that we've recently launched a new resource on our app. In the resource section in the menu on our app, users are able to access the website healthybirthday.findhelp countthekicksApp.com. All they have to do is enter their zip code and search for free and reduced cost services that they may be in need of. So maybe they're looking for Section 8 housing or a local doula. Maybe they need help with food banks in their area. The list on the website that we have is constantly being updated, and we look to others to let us know if a service or an organization is missing on the list. So with you downloading our app, playing with it, if you notice there are some key organizations that need to be added or listed on this website, please contact us and let us know by emailing us at info@countthe.kicks.org, and we'll be glad to update that information. Next slide, please. I'd like us to take a moment to watch a quick video so that you can see just how easy it is to use our Count the Kicks app, and you'll be able to share this information with the expectant parents that you serve.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
Now I'm going to turn it over to Kim to talk about how to talk about stillbirth with expectant parents.
Thanks, Stephanie. We all know our clients look to us for sound medical advice and support. Shout out to my nurse peeps. We're not the #1 most trusted profession for nothing. And recent studies have reinforced that the healthcare provider's influence is strong, and expecting families need to know about tracking fetal movements and that they should contact their provider with any concerns as soon as possible. Sometimes they just need to be given essentially permission that it's okay to contact their provider and share their concerns with them. Next slide. When we talk about stillbirth with pregnant women, I've given presentations to providers about stillbirth prevention efforts, and I've heard comments such as those listed here. They say that they don't want to scare expectant parents, but pregnancy is full of risks that we need to talk to moms about, and stillbirth is just another risk that expectant parents deserve to be educated about. Stillbirth just happens. There's nothing we can do. Well, there are warning signs if moms know what to look for. Her baby is always active and is not a concern. Well, babies are active until they aren't. Cord and placental accidents can be sudden, and moms need to know what's normal so they can notice a change. And then she's almost at her due date. The risk of stillbirth increases as a mom approaches or exceeds her due date. And some studies say that the risk is increased up to 64% at 40 weeks gestation. And Megan will post the source of that data in the chat for everybody here. And we know and understand that talking about stillbirth is not something anyone wants to do, but it is so important. Expectant moms hear about all sorts of different things that can happen to their baby. And we talk about the importance of taking folic acid supplements, of not drinking alcohol, and et cetera. And this conversation should be part of your routine exam with expectant moms. Imagine if a woman discovers that they could have prevented their baby's death if only they knew to report their baby's decreased fetal movement, or if they were informed of the risk factors that could lead to stillbirth. Next slide. When we talk to moms who have had a previous stillbirth about fetal movement, we get a lot of questions about what to say or what to do when talking about fetal movement monitoring with these women. And here are some tips we've learned from parents of babies that are born still. And I'm not going to go through these for the sake of time, but they will be on your slide deck for you to review. Next slide. Thanks.
So now Kim and I are just gonna go through some common misconceptions. So if I was the patient and Kim's my nurse, I could come in and say, you know, I'm not high risk. I'm not a high risk pregnancy. I'm 7 months pregnant, but I don't have any high risk things. So I don't need to count my baby's movements. And she would say,
well, this is false. All pregnant women should be educated on counting the kicks and get to know what's normal for their baby. And a lot of times you're not high risk until you are.
correct. And how about, I've always heard that I should just get 10 kicks in 2 hours.
Well, every baby is different, so this is false. The recommendation to expect 10 kicks in 2 hours is outdated. And current research indicates that moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements each day and determine what's normal for their baby.
Well, I have an app on my phone where I can use to hear my baby's heartbeat.
Well, this is false, and you can't rely on this because a change in the baby's heartbeat is one of the last things that occurs when a baby is in distress. A change in the baby's movement may indicate potential problems before actual changes in the heart rate are detected. An expectant parent should only use a Doppler device under the guidance of a healthcare provider.
Because correct me if I'm wrong, Kim, if somebody comes in with reduced fetal movement, the nurses and the medical team will not just be using a Doppler device to check on baby. There's additional testing that goes on, correct?
Exactly. Ultrasounds, extended fetal monitoring, non-stress testing, et cetera. Yep.
Yeah. All right. Well, I noticed my baby wasn't moving that much or like normal. So I had a Mountain Dew and a Snickers bar to try to get baby to move.
That sounds like my regular diet, but when you're pregnant, that is not something you should do. Research has moved away from the idea that sugary drinks and the like are a good way to reduce the baby to move. Kick counts are best measured without interventions like juice, candy, etc. And if the baby isn't moving like normal, like the woman has come to expect, then the parent should speak up to their healthcare provider right away.
Right. Because when you and I are sick, we're not chugging a bunch of Mountain Dew and eating Snicker bars to try to get energy up and move. We're trying to rest, watch daytime TV, and sleep.
Exactly.
I was talking to my grandma and she told me that my baby was running out of room and that's why the baby wasn't moving as much.
Well, grandma is incorrect on that one. Babies don't run out of room at the end of pregnancy. I mean, the female uterus is designed to stretch and expand to accommodate the pregnancy, but the types of movements may change. More jabs, fewer rolls, for example, but the baby should move up to and even during labor. If an expectant parent is monitoring their baby's movements at the same time each day, it should take about the same amount of time to feel those 10 movements.
Great. My next one up. Okay. What about the dentist? I feel like I don't want to go to the dentist. I'm worried about getting all this work done. So I'm just not going to go while I'm pregnant.
Well, this is not a good idea. Good dental health is always important, and pregnancy can increase an expectant parent's risk of dental issues, thus their overall health issues.
And I had to go to the triage center when I was pregnant, and I didn't think they needed any Count the Kicks materials because I would just get registered and have baby right away there once I went there.
Well, the labor and delivery triage is a perfect place to have the information available. Posters, brochures, and discharge papers all should be used when someone comes in for anything and is sent home. This is the perfect opportunity to talk to the clients about counting the kicks.
Yes. And that's really a great segue into our systems change work. So when you're thinking through systems change, think through what you already do when you're talking to patients, when you're talking to your clients, and how you can integrate this. Could you add information to discharge paperwork? I went to triage 3 times with my daughter because she was taking forever to get her movements, and I did not know what was normal for her. I hadn't figured that out yet. And the app came out in 2015. That's when she was born, so I missed that. So that would have been the perfect time to have triage say, hey, here's how you know what's normal for your baby. You count the kicks. This is what you do, X, Y, and Z. Have your entire staff trained, have them take this recording and watch it. If you're a home visitor or somebody that does family care plans or intake forms, can you add questions about talking about Count the Kicks, or it's time to talk about Count the Kicks? The glucose test, like Stephanie said, I remember having to get the glucose test and sitting there for an hour, drinking that awesome orange drink, and then getting my labs drawn. So that would be the perfect time to say, hey, drink this wonderful drink, sit here for an hour, read this brochure, download the app, and then we'll talk about it. My favorite, can you integrate this into EMR or EHRs? And I'll show that in a minute. Can you add Count the Kicks to a phone recording? I'd be happy to do that. Or you find somebody with a wonderful, beautiful voice to give you a recording to share when people are waiting to talk to the nurse or something like that. So this is our gold standard of an after visit summary, or what you could have like a discharge papers. This is Mary Greeley. So hats off to any of my Mary Greeley friends on here, but they implemented this. So I'm happy to send this out to you if you want to integrate this into your discharge paperwork and things like that, because like I said, I went in 3 times with my daughter. Every single time they did all the tests, everything was great. She was just I needed to understand 30 minutes was her normal when I was tracking movements, and she was born at 38 weeks, totally healthy, and now she's 6. So reach out to me if you want to talk through how to do this. Other partnership examples, we have a lot of great ideas of how you can integrate this. So please connect with me, because that's what I love talking about. So now it's finally, we're nearing the end of our presentation, I promise. But one of my favorite parts of the presentation is I get to play this awesome song by Pharrell Williams. As you all know, we have free educational materials. So what I'm going to do is I'm going to play just a couple minutes of this song. We have 10 minutes left. Come back, don't go anywhere. Scan the QR code, go to counttthekicks.org, go to order materials, and fill your shopping cart and go ahead and make an order. If you do so today during this presentation, you'll be entered into win another chance for an Amazon gift card. So let's take a moment, let's take a breather, listen to some cool music, and order your materials to put up in your waiting rooms, into your restrooms, into your, if you drive around the community, could you keep a stash in your car and put it up in libraries and things like that? So I'm going to give you just a couple minutes because we still have just about 10 more slides left. So go order and come back. I'm going to skip ahead.
Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way.
Okay, sorry, I'm going to give you more time. So keep ordering. I know we can all multitask, but to get through the next couple slides, not only do you get credit for taking this presentation today, but we also have an online CE training very similar to what you took today, but you can share it with your team members. You can get additional CE credits. It's completely free because of our partnership with Iowa Department of Public Health. No worries to write this long web address down. I'll send it in the follow-up post-webinar email. But you use the code SAVEBABIES-IA for Iowa during registration. It'll ask you to do a coupon code, and then you can access the training for free. We have a lot of great other free resources. We have a parent academy, a provider academy. We have kick counting charts in English, Spanish, and Haitian Creole. We have videos. Please take advantage of all of the great resources that we have on our website. They truly are made in mind. We get feedback from nurses and providers. We get feedback from expectant parents, and that truly does help us create what will work best in the community. We also have ambassadors. So another great resource are volunteers. Sometimes they're lost moms, sometimes they're birth workers. They're just wonderful, passionate individuals who are willing and able to talk about Count the Kicks. They're trained. And Iowa's ambassador is Jill Bartlett. I don't know if she's on the call today, but she currently is a perinatal nurse practitioner at Unity Point Health in Des Moines. And one of her quotes as to why she is an ambassador is, I love this, and it's from the website, but it says, as one of the unit's main charge nurses, I spent many hours educating patients on the Count the Kicks program. Thankfully, because of that program, I've witnessed multiple saves. My patients at the perinatology clinic are high risk for multiple reasons, making the need for them to count the kicks even more important. I'm passionate about improving the outcomes of Iowa families and their babies, and know that Count the Kicks is an easy, effective way to do that. So Jill is able, in her free time, volunteer time, she can do presentations like this. She's going to do a couple baby shower presentations for us in Ames and Story County. But we have a lot of great volunteers. And so finally, wrapping up, what do you do next? Obviously, become familiar with Count the Kicks in the app, which you already have. You've downloaded it, you used it, you're going to share it with your patients and your members. You're going to order materials, which I should get, my email inbox should be flooded with orders. So I'm super excited about that because you've already done that. Maybe you could designate somebody in your office to oversee ordering material. This should really take only 3 to 5 minutes every single time you see somebody. So it is imperative that you talk to your patients and members and clients about this, and that you encourage them and really push that you want them to do this daily. That is how this works. They need to understand their baby's normal movement pattern daily. So making sure that you have that kick counting conversation at every single touch point in the 3rd trimester. Make sure your entire staff knows. Be sure to share and forward the email that you're going to receive in a day or two about this. Use EHRs, intake forms, talk to me about it. I would love to work with you in your individual organization to see what would work best to integrate this. I'll put my email contact information in the chat after this. And then remember, hours and minutes matter in preventing stillbirth. If you work in a birthing or maternity desert, and you're a family care practice, and your moms have a 45-60-minute drive, right? They can't wait for the clinic to open the next day. They need to get to the ER. They need to get to the nearest birthing center to see what's going on. Better safe than sorry. So educating patients and staff on how to expedite concerns about movement. They shouldn't be left a voicemail. They should be contacted right away. They should talk to somebody right away, and they should be seen right away. So why do we do this? Why are you on this call today? Why are you learning all about this? We do this so we can save more babies just like Nala. Nala is a Des Moines baby save. She was saved a couple years ago, and this is her story.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if? Definitely to pay attention and count the kicks, I feel like it's important just because had I not, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
So we have a lot more baby saves on our database. If you know about one, let us know, because we want to shout them from the rooftops, because this is what you're going to remember, right? You're going to remember Ruby, you're going to remember Nala. And so share with us, you know, go to our social media. You can share with your clients and patients. We have one more poll and then we will wrap up. How do you feel now? We're happy to answer any questions. I'm going to go ahead and put my email address in the chat. We're happy to answer questions. Go ahead and fill this out. How do you feel now? One word or multiple sentences. We're so thankful for your time today. We know it was a long presentation, but hopefully you found it, learned something new. If you already knew about Count the Kicks, I'm just gonna write my chat in here. We're happy to answer any questions, or you can email us after. Like I said, here's just some of the baby faces that we've seen. Oh, here we come. Motivated, energized, knowledgeable, informed. Oh, you guys rock. I'll update this. This is the wrong email address, so use the one that I just put in the chat. But here's some of our beautiful, beautiful baby saves. That big one there with the black bow, the big picture there is Luna. That's Stephanie's granddaughter. That's Nala with the red bow there too, where you just saw her video when she's a little bit older. Eva's the 5 months over there. Oh, just so beautiful. We love it. So thank you. We're happy to answer any questions. Thanks so much for the kind words. I hope we answered all your questions. I know there were some in the chat. So I think we answered those live. Feel free to go. You'll get the certificate and probably in a couple days. I think it takes a little bit to get those sent over to DMU. And so Emily, hi Emily, good to see you on here. You can raise your hand too. I can unmute. You're all muted. So thank you, Eleanor. Thanks, Bailey. Thanks, everybody. Oh, we'll stay on for a couple more minutes. And Julie, I will unmute you. It looks like you raised your hand. Let's see, which Julie was that? I think I lost you, Julie. Are you still on? Did you have a question? I'm not seeing it on here anymore. Thanks, Raquel. Thanks, everybody. Is it Jessica? Is it Sayla? I don't want to pronounce it wrong. I apologize. Great knowledge. Thanks, Tammy. Thanks, everybody. Can I get the QR code to download the app? Yeah, I'll send that in that's a great idea. I'll send that in the post-webinar email. But I will go back to that screen too if you want it right now. Hold on. Let's go through all of this.
You passed it already.
Oh, I did.
Mhm.
Too many.
There
it is. There it is. But I will send it too. Thanks, Lisa. Did I miss any more questions? Sorry, I don't see the hand up anymore. So maybe it was just an accident. My daughter lives in North Carolina and they don't use this, but I had my daughter download and use it. She shared the info. Yeah, we're not launched in North Carolina, but you're right. Anybody can use the app. It's completely free. Like Stephanie said, it's been downloaded in 140 countries. And her North Carolina provider, Crystal, can order the materials. They're really low cost. They're like $5 a bundle. So we would love to launch in North Carolina. So if that doctor wants to talk to us, it's always nice to have additional support when we go to like a health department or insurance company or things like that. So I'd be happy to connect with your North Carolina contact. And congrats to your daughter and her pregnancy. Oh yeah, sure. That'd be great. Thank you. Awesome. Any other comments or questions? Thank you to my other presenters, Stephanie and Kim. You all are wonderful. I value our relationships. I love working with you two wonderful ladies. Thanks for giving up an hour and a half and more of your time today. I appreciate it.
It's worth it. Saving babies is always worth it.
is.
So
It is. It's so wonderful to talk about and inspiring to hear you all talk and share your experience and everything like that. So I'm going to stop recording. Oh, thank you. Bye.
Thank you for your kind comments, Justina.
Yes.
mhm.